The SEC taught us that anything is possible, that just when you think you've seen it all, you won't believe what happens next, that comebacks are not the makings of miracles, but are born out of preparation, perspiration, and perseverance. As the official bank of the SEC, at Regions, we take these lessons to heart and strive to bring our best every single day. What has the SEC taught you? Join the conversation with hashtag SEC Lessons. Regions Bank, member FDIC.
Broadcasting live from the Subaru of Gwinnett studio inside the Sonesta Gwinnett Place Atlanta Hotel, it's time for Gwinnett Business Radio. Gwinnett Business Radio is presented by Regions Bank. Brave the beginning. Member FDIC.
Welcome to Gwinnett Business Radio. I'm Duffie Dixon, your host of a very special show today. We are live at Eastside Medical Center. As 2020 comes to a close, we've got to talk about what dominated 2020 COVID, and more importantly, what it's been like, but also the vaccine that is now in the hands of so many, especially here at Eastside Medical Center. So now, to welcome my guests, we are so excited to have you with us. These are three very busy people right now, but they're taking a little bit of time with us. First, Trent Lind. He is the Chief Executive Officer of Eastside Medical Center. He is joined by Tracey Smithson. She is the Chief Nursing Officer. And also Dr. Stephen Higgins. He is the Chief Medical Officer. So we basically have all the people in charge right here. And boy, I'm happy to see you all still standing. This has been a year like no other. Trent, because you are the CEO, let's start with you. Give me a sense of what this year has been like.
Where to start? You know, we kicked off this year kind of early February, recognizing there was this virus that was across the world. And then early March began to have some discussions around how this could impact the United States and certainly our local community. And from that point on, it has been literally a marathon that we've experienced in our organization. We've seen over 800 plus patients who have been inpatients with us, whether in our ICU or a medical surgical unit or progressive care unit, who have been positive inpatients with Eastside Medical Center. We have been inundated in our ER. You look back to the number of patients that have come in to either be tested and or have tested positive in our ER, and it's in the thousands. Our urgent care network played a really large role over this past 9 to 10 month period of time. Upwards of almost 30,000 tests that have been given in our urgent care network. And so in all that, really it comes down to an environment where obviously inundated with volume, obviously the impact that we see to our employees, the impact that we see not only emotionally, but certainly physically if those employees that convert positive, and then the impact it has on an organization when you have those employees that are unable to work and you have the stresses of the volume still here. And then to take it that much closer to home, we've seen plenty of examples here where whether it's one of our employees that's become an inpatient, or they have a loved one, or we have a loved one that's being impacted somewhere in the country, certainly it all hits home. But in all that, I've been so proud of our team. We've come together collectively to really fight this battle, and I think we used that analogy early on that this is a war that we have against this virus, and we're going to do all we can to protect our employees, to protect our community, while at the same time moving towards a hopeful solution. And then you fast forward, and here we are, 9 to 10 months later, and we have a vaccine.
That's incredible.
Yeah, and so we've vaccinated our first patients, or really employees and physicians that are on the front line starting last Thursday. I had our hospital medicine medical director, Kavita Kote, who was our first to receive the vaccine. She took it like a champ. And then now we already have upwards of 250 employees and physicians who have received their first dose. It's a 2-dose vaccination process, and so they'll come back to us, those that have been vaccinated, in the next 20 days and receive their second dose and be fully vaccinated at that point. I know my colleagues next to me, Steve and Tracey, were proud soldiers and got up, and early on in this process on Friday, and were vaccinated. So really exciting. We see a light at the end of the tunnel, in which we hadn't seen in a long time.
That's right. It is. It's a great source of hope for a lot of people. Tracey, let me ask you, you did get the vaccine. For everyone out there, tell people, I mean, we've all had vaccines in the past, but what is it like? Take me through what it will be like when those of us who aren't frontline workers get the chance to take the vaccine.
Well, first of all, I've taken so many vaccines in my career that it was no different than taking a flu vaccine. I'm proud to say that I've taken the flu vaccine every year, and knock on wood, I've never had the flu. But it was obviously a little apprehension. I think talking to my colleagues and some of the frontline staff, we know it's the right thing to do to protect ourselves and the community. But you always have a little apprehension. But the shot was no different than taking a flu. Wasn't painful. 3 days ago, we took it at 10 a.m. on Friday, and I've had no adverse reactions or symptoms at all. So I've talked to several people in the hospital that have also taken it, and no symptoms. So that's a good thing, and we're excited to continue our vaccine clinics. We're working through next Tuesday, take off for Christmas, obviously, but trying to get as many healthcare and frontline workers, physicians, staff, anyone that comes in the hospital vaccinated, so they're protected.
And how have people been? You said some people were a little apprehensive because it is brand new, right? Mm-hmm. And we got it out within a year. But these are medical professionals, right?
Absolutely.
They know the science. But what's this been like? Has this, Trent mentioned it's sort of a light at the end of the tunnel. But give me a sense of morale and how people are feeling now that the vaccine is here and they are getting vaccinated.
Absolutely. If I could say one word, I've had a couple of interviews already, and I keep coming back to the one term of hope. I think that actually the physicians and the nurses throughout the country are just exhausted. We're very exhausted and tired of dealing with this. It drains you physically, emotionally, and spiritually on what we've had to deal with. I think it's forced a lot of people into early retirement and people to really second guess. If you're called to be in the healthcare profession, it's one thing, and those that aren't, I think, aren't in it anymore after a few months of this.
Separates those who can do it and those who can't.
Absolutely,
sadly. Yeah.
Absolutely. And just COVID wreaks havoc on our environment, on our patients and our staff. And so I think we're just so excited that there's a vaccine. And like you said, hope is in the future. And we're looking forward to this working and decreasing our positive rates within the hospital and their community. And just hoping that we get through this next phase to get the herd immunity. We've got to get through spring and continue to be warriors with our mask and social distancing and being smart about what we're doing. And that's what we would preach to all of our staff and the community because Christmas is this week. And so we've seen time and time again from 4th of July, Halloween, Thanksgiving.
Right, the big holidays.
Absolutely. And the people that really suffer are the patients and the staff because it increases our volume. And we've had some nurses that have tested positive. So we have a shortage of healthcare providers out there. And so I'm hoping everyone stays smart over Christmas and New Year's, and we don't see in 3 weeks the result of it not happening.
Right. Let's just not hope for that.
Absolutely.
Dr. Stephen Higgins, who is the Chief Medical Officer, talk to me from the doctor's perspective. As overwhelmed as nurses are, doctors are in the same boat. Tell me what it's been like for the doctors at Eastside Medical Center for this year. This is uncharted territory.
That's absolutely correct. From the physician perspective, it's been a learning experience. Obviously, this is a new organism that we've been dealing with, and it's really been impressive to see how our system has learned as we've gone through this, and we've developed therapeutics, things like you've heard about remdesivir and convalescent plasma and steroids, things that are really making a difference in our patients. And if you look at the earlier waves of this pandemic versus now, what we're seeing is a little bit less of the folks at the critical care end of the spectrum, which to me is a reassurance that many of the therapeutics that we're able to use are making a difference. What's impressive to me too really is to think about the incredible partnership and collaboration that allowed us to have this new tool, this vaccine that's going to allow us to turn the tide on this pandemic. Just seeing that collaboration and partnership from the federal level down to the state level.
And private industry, which was two companies vying for...
Yeah, and local public health departments and all the way down to the facilities, this partnership that allowed us to be only 10 or 11 months into this and now have a vaccine that we're actively administering to our team. And another thing, sort of what Tracey mentioned, was just that feeling of fear and vulnerability that you have as a healthcare worker. that now that we're able to protect ourselves with this vaccine after we've had our two-shot series just helps to alleviate some of that fear and apprehension that you have in dealing with this virus.
You know, there's been a lot of talk in all businesses about people who have either pivoted what you do, right, as a service, as a service, or as a provider pivoting. So you talked about, shortages at times, and healthcare workers and doctors being burned out, and if someone tests positive, things like that. Tracey, what have you seen as far as people's? You said a lot of people who realize maybe they don't want to be in healthcare got out, right? Mm-hmm. But have you seen people who have sort of taken on new roles? I know that for a lot of people who are maybe new into nursing, I have a friend who is new into nursing, and she said, I am getting to do procedures and learning and getting to look over procedures, things I may not have even been asked to learn or do early on. Yeah. And then, met people coming out of college, trying to get some people fast track to help where they can. Mm-hmm. So give me a sense of how people have pitched in. You said you're really proud of your team. Mm-hmm. What have you seen?
Oh, gosh. I have so many stories that I could probably talk to you for a couple of hours about the things that not only our staff have done, but as you mentioned, the new grads. So we normally have 3 cohorts, 3 to 4 a year of new grad residents, people coming right out of nursing school. So we are now doing that every 2 weeks.
Wow.
So people that have fast-tracked through their organization or school are coming on about every 2 weeks. And when I stand in front of them their first day, I say, well, you picked a good time to be a nurse, right in the middle of a pandemic, because that's correct. We can use them and we need them in just a start. And so they are literally, there's no more, let's take 13 weeks to, learn this and learn that. They are really getting at the front of the patients immediately. They're making a difference immediately with our staffing, taking on different loads that we would slow that process down because we don't want to burn a new nurse out. And it is a little scary to be standing there as a new grad for the first time, but we don't have that luxury of time right now just because we are really facing shortages in the nursing profession. The community is what I would say, because there are positions and jobs out there. But for a nurse that stays in the community and stays with the community hospital like they've done at Eastside, those are the true heroes to me. I know that we need nurses throughout the country, but the nurses that have stayed here are staying at their same salary. They're taking care of their communities and their families, and I view them as the true heroes because they keep the hospital open and they allow us to take those patients in through the ER. So that is one thing that we have definitely seen a change in. Everyone's had to step up in leadership, in infection prevention and quality, nurses at the bedside. I have nurses right now in our immunization clinic. We've been going since 7 this morning. We'll go till 5. I've got my IT guys who are RNs giving shots. I have my diabetes educator giving shots, my educators, my behavioral health campus giving shots. Because you imagine we have, about 975 injections that we need to get out to our staff, and we have a time limit to do that. So everyone's stepping up and pitching in. That's the beauty of Eastside. It's definitely a family. We have a slogan at HCA, Care Like Family, and it's never been witnessed so many times as we have since last February. I thought and knew we were a good organization, but now I know we are.
And Dr. Higgins, for doctors, have doctors sort of pivoted or expanded what they do, or find themselves helping out in areas that maybe, a doctor is usually trained in everything and then specializes, right? So how have things been, the workload, how has it been for doctors?
Well, the workload, that's an easy one. Heavy, yeah, actually, yeah. It's been very busy. We've been through 3 waves. This is kind of our third wave of the cycle. Everyone's just having to step up and pitch in. And what it's really reinforced is the importance of collaboration between the primary care physicians, between the hospitalists who are managing the general medical patients, as well as our intensivists in our ICU, and as well as specialists, pulmonologists, infectious disease. So it's just highlighted the importance and value of that collaboration. And another big part of what the physicians have been a part of is helping our community understand that it is safe to get your health care in this setting. We saw early on in the pandemic, a lot of folks were afraid to go to a hospital, not really recognizing that the measures we had in place made the hospital one of the safest places you could be. So our physicians really partnered with us on that, helping to educate their population, their patients, that it is safe to come. And those things that may be considered elective procedures, they're not truly elective. I mean, many of those are things that people need because they've got chronic pain, or if it's not fixed now, it could have more consequences later. So helping work with their patients so that they're confident and comfortable coming in to get their care has been a big physician factor as well.
Yeah, and give me a timeline here, because I think you're right. Everyone put off doctor visits, right? Some people could do it when telehealth, right? We've all heard about telehealth.
Yes.
It actually was being used, Zoom calls and things. But for people who had, you're right, procedures that they thought, well, I'll wait. Once people got the word out that it is safe to go to the hospital, as you said, it's a very safe. Did you have sort of this wave of all these procedures that have been put on hold? I mean, that's got to create a whole nother set of issues.
Yes, we did see much of that care come back to the facility, and we're really excited to see that for the benefit of those patients getting their things taken care of that they needed to. I think there's still some opportunity for the population to overcome some of those fears and realizing, again, that it's very safe to get your care here. And there's really more of a risk of delaying getting your care than there is the potential exposure to COVID.
I have a really good story I could talk about. It was a comment that early on, I think it was June, where it's kind of a sad story as well, but a priest came in to the ICU to give last rites to one of our patients. It was a mother who was devoutly Catholic her whole life, and so got to meet with the family, but I took the priest in because there was no visitors at that time, and still on COVID, there's no visitors. And they didn't want to go in. They were elderly as well, but they were very adamant about the priest going to visit with the mother to do the last rites. And so went through the whole process with him, went in and got to witness it. It was very emotional and beautiful experience at the same time. But at the end, when he came out, I literally was helping him wipe down everything with the wipes that we have. And he said, and he had researched it. He knew about his shoes, and he was going to take things off in his car to keep himself safe in the community. But he said, I feel so much more secure in this hospital than I do out on the street, because you guys know what you're dealing with. And I think it was a true testament to the healthcare professionals. And I feel genuinely that most patients say that and feel very confident about being in the hospital, because we do know the status of most every patient that's in our hospital, and we know how to treat it, and so we know how to keep it safe. And our positivity rates within our staff is very minimally low compared to how many patients that Steve referenced and Trent referenced that we've taken care of throughout this pandemic.
Steve, tell me too, we talked a little bit about the treatment and how it has evolved since we first started dealing with COVID. Are these things that can help in the treatment of other things? I mean, you talked to some of the drugs that we're now using and some of the protocols, things like that. COVID, the survival rate is, what is the 99 point whatever. So is everything we're learning now about COVID and how we're treating it and dealing with it, can all of that be used in other areas?
There are going to be many opportunities where the things we've learned from this can spill over into other areas. There's a lot of different categories of viruses. Who knows what's going to be the next one coming down the pike, but many of them act in similar ways. And I think some of the things we learned about with the coronavirus are going to be transferable to those other things as they develop. With this disease, we have that early phase in it where it's just rapid multiplication of the viruses, and that's where things like remdesivir can have a significant impact. Then we have if they continue to worsen, then they go into what's called an inflammatory phase, and that's where things like dexamethasone can really make a difference. But other areas that we've really learned a lot is about how to expertly manage these patients when they're on ventilators, carefully monitoring and keeping parameters within certain specifications, and learning to prone the patients. And these are not brand new concepts, but they're things that have really been refined as we've gone through this, and are really making a difference in saving the lives of these patients. And many of them are going to be transferable to other things that potentially could come in the future.
That is maybe we talked about light at the end of the tunnel. Maybe that is the silver lining, all of this, the technologies and things that and the treatments that we're figuring out now. I'm sure you all have stories about your lowest moment, and I don't want to take it down into the basement for long, but what would people be surprised to learn? Or what really is going to stick with you through this? And I think, Tracey, you kind of, you as nurses are often the people who have to tell family members you can't come in. I had to take my husband to the emergency room for something totally unrelated, but we got to the front door and they said, you can't come with him. And that's a tough thing.
Yeah, absolutely. I would say that's probably, you kind of hit the nail on the head. Nurses and physicians are caregivers, and so we want to help people or we wouldn't be in this profession. So it's so foreign for us to have a family member that's in an ICU on a ventilator or who passes away by themselves without their family. But I do want to, say the one thing that I guess, and probably, I don't know if it's low or inspirational moment, is just some of the good stories that have come out of it. And I know Steve has a favorite one, so I'm not going to share that one. I can't steal Steve's story.
We'll ask Steve his own story.
He has a very good story that happened early on. There were so many, but just I think probably the one that sticks out, that's a tough one to think about.
Oh, I'm sorry.
It is just, it was really the very first time that I had to take a family member. Visitation was under my purview. For the CNO, had to oversee anybody that was coming into the facility on a COVID positive patient. And this was the first time that I experienced it. And so it was a grandson. I was someone that actually was a healthcare worker at Emory, and his grandfather was here, and he was in his last few hours. And so the family elected this grandson to come up because they were older as well. And it was very early on, so they were scared. They didn't want to come because we do take limitations and open those up to where it's end of life situations, right, where we allow the families. We want to make sure that every family can be with their loved one. So this grandson came up, and we had a great talk, a really smart individual, but it was just me witnessing his last conversations with his grandfather and having the family on his phone for FaceTime. And just the nicknames that they called him, they just reminisced about some experiences in the past. It was obviously, because I'm still touched by it, it was just really heart-wrenching to see that grandson do that. And that was probably my lowest moment. But then on the next breath, you have to think, well, we are here for a reason. We got into healthcare for a reason. I know I'm definitely called to be in it. So it was a privilege to witness that and make that possible. And I know that many nurses and physicians have done the same thing. It's a privilege to be with someone and hold someone's hand when they come into this world. But it's also when they take their last breath in this world, it's a privilege to be with them and an honor to make sure that they're not alone and their family knew they weren't alone. And I think that's the biggest obstacle that anyone in healthcare has had to overcome in this pandemic.
Right. And what a comfort.
Yeah.
We have heard so many stories as upset as people were early on, they couldn't see their loved ones. You guys have really, and the fact that you can make those decisions on the local level and say, it's okay, let's bring someone in. So thank you. I'm sorry, I didn't mean to upset you, but I want people to know, I want people to know that, you guys are making decisions that these are things that, like stories like this you haven't heard since a war, right?
Yeah.
Mm-hmm. So people in the trenches, who have to become, the people who hold hands to the very end. But I don't want people to lose sight of that because
Absolutely.
Obviously it's not over yet.
No.
But you unfortunately you have a skill set now, I guess you would say. But okay, Steve, what is your story?
That's a good one.
All right, I guess I'm set up. So this was fairly early in the course of the pandemic. We had a young lady in her 30s who was pregnant in about the early part of her third trimester, who came in and she had COVID, and we brought her into the hospital for a while. She wasn't doing very well, and it was looking like it was going to be important to take the baby early. And so that's what happened. She underwent a cesarean section and had the baby. The baby had some challenges initially, but good news, the baby recovered and did well and went home with Dad, who was also positive. So he had to, for that initial period of time, he couldn't see his wife or his child.
Wow. Yeah.
But after her surgery, she continued to struggle, and she was in our ICU on a ventilator. And it was a patient we round on every day on every one of our patients. We had an incredible nursing team providing meticulous care for the patient. She was getting all of her therapeutics that we knew at the time, and we were managing her vent just as meticulously as we could, but she just wasn't getting better. Days turned into weeks, and weeks turned into greater than a month. But every day we were all asking about her by name because we kind of became familiar with her and her story. But somewhere about halfway into the second month, she started to turn the corner, and her ventilator settings improved. And eventually she was able to have the ventilator taken out and recovered and went home.
Oh, wow.
So persistence, diligence, always providing that evidence-based best clinical practice, with partners or physicians partnering with their nursing colleagues to provide expert sensitive care for the patients. It pays off in the end. So what a day that was to see this young lady be able to actually go home
my
and
goodness.
be reunited with her infant and her
That
family.
had to be amazing. All right. Well, we're going to ask a final question of Trent since he is the CEO, and this is looking forward. It's a hard act that you're following, I know, but this is a testament to your staff that these two individuals have these kind of stories. They are in supervisory roles, but clearly they are also caregivers themselves.
Absolutely.
So we have the vaccine now, right? We feel like we have light at the end of the tunnel. From here on, what happens? What do you hope happens? And how can the community help these individuals at Eastside Medical Center and other hospitals who are still in the trenches?
I think it's still pretty straightforward in regards to what we need from the community, and that is there's light at the end of the tunnel. That said, sometimes our optimism breeds a lack of compliance, if you will, with what those protocols are. And let's maintain our diligence. You even hear from the CDC that likely will be wearing masks through all of next year. So we won't be out of the woods for a long time. And so, when we think of our experience here, we want to continue to preach that the hospital is a safe place to be. I say all the time, I'd rather be in the hospital than in the grocery store. And so really just making sure people know that we're here for them. But certainly when it comes to our social responsibility, follow all those measures and make sure that we're doing our part to continue to flatten this curve. The vaccinations, again, bring a great light at the end of this tunnel, but the tunnel is still long. And so that's what we ask of our community.
And as we close this, thank you again to all of you, and for everyone listening, a safe 2021. Keep up your guard, and thank you so much to the doctors and the nurses and all of the staff at Eastside Medical Center. And we wish you good luck, and let's focus on that light at the end of the tunnel. Thank you for joining us on Business RadioX.